Hi folks, I'm Steve Duvall, West Coast Therapy Specialist. Today's training is on UTIs. UTI stands for urinary tract infection. When we speak about the urinary tract, we start with kidneys, go to the bladder, and then the urethra. That is the tract for the urinary system. Urinary tract infection is obviously an infection in any part of that system. Who is at risk for urinary tract infection? Elderly. Elderly is the highest population that contracts urinary tract infections. As a matter of fact, UTI is the second leading cause of infection for the elderly. Number one leading cause is respiratory infection. But this can make your older resident very sick very quickly. The elderly are at risk. So is a resident who is bedridden, someone who can't get up to get their own hydration, can't get up to do their own toileting, so someone who is bedridden. Another population that is highly susceptible to UTIs is a patient or resident who is catheterized, someone who has a catheter, either a lead cath, a Foley cath of some time. And the reason that is because we have an open to the environment system because we have a catheter going into the urinary system. Very prone to that infection. Another obvious one who is at risk is someone who has had an UTI in the past. As a matter of fact, if you've had a UTI, you are 4 times more likely to get another UTI than someone who has not had a urinary tract infection. Now we go into signs and symptoms for UTIs. One of the things that you can look for right away is a change in mood or behavior. Now, in the hydration and dehydration training, we've gone over things like change in mental status. This is one of the same things here, is a change in mood or behavior or mental status because of this infection. Another thing that you look out for is a change in urine. Again, with dehydration, that was a common thing, that we had a change in urine. It was usually darker or more highly concentrated. But with UTI, we find there are even more changes. There can be cloudy urine that you see, that you spot, the dark or concentrated urine, foul or a bad odor in the urine, blood in the urine, which you're probably not going to see that when you collect a sample. You may or may not, but you're not going to do that, but it is a sign and symptom if there's a UA, a urinary analysis. They're going to find blood in the urine. And then finally, frequent urination. If someone has UTI, they're typically going to urinate more, and it can be painful in urination. So those are your signs and symptoms. One of the things with the pain is that you can get flank pain, okay, along the side here. You can get abdominal pain. You can get low back pain, and that usually is a sign of some kind of infection, kidney infection, bladder infection, or something like that. Okay, how do we prevent getting UTIs? This is very important. It's basic information, but wiping the resident, especially your female residents, you have to go front to back, okay? You keep them clean in the front when you wipe, front to back. It should be common sense, but we have to train that way. Another thing is that we want to push the fluids. We got to push the water. So going back to the dehydration training and videos that we've done, we got to keep fluids in somebody to keep them from having these urinary tract infections. You can use cranberry juice too as a way of fighting these infections, and something we use prophylactically where we keep them from getting these urinary tract infections. Also, some facilities will use a cranberry extract as a supplement for people who are prone to urinary tract infections. Finally, cleanliness. We got to keep these residents clean in their perineal area. Using disposable wipes versus towels is a better way of keeping them clean. Bathing regularly and keeping them clean down there through bathing and showering is a great way to prevent. And then finally, if they have soiled garments, change them frequently. Don't let a resident sit or lie in soiled garments, because that's only going to promote the infection. And this goes for urinary incontinence or bowel incontinence. One of the most common organisms that are found in UTIs are found in fecal matter and in the colon. So we got to keep them clean. So that's what we want you guys to be aware of with urinary tract infections. Here's a quick 3-question quiz on UTIs. Question number 1. True or false? A 25-year-old is more likely to have a UTI than an 80-year-old. True or false? Number 2. The urine is always clear when a resident has a UTI. Number 3. Give 2 ways to prevent a UTI. There are many, but just give us 2. Good luck with your test, and thanks for watching the video.